everyone. A very good morning to all of you. I'm Sayukta from Prostate Wellbeing Team, and I'm sure all of you must be doing really good. Today, we are going to discuss a very important topic, benign prostatic hyperplasia, very commonly known as BPH, which is the non-cancerous enlargement of the prostate. Usually begins in 50s in men, which in many men may cause obstruction to urine flow. Many men have to get up and go to the toilet at night and is one of the most troublesome aspect of this condition as it makes them tired during the day. Having to urinate frequently during the day, sometimes with a sense of urgency, can also be tiring for patients and can make traveling or attending events such as theater, cinema, going out in public rather more difficult. So doctors such as a neurologist can treat this condition and help the patient to get relief. To throw more light on the subject and guide us on what's right for diagnosis and treatment of BPH, today we have with us renowned urologist Dr. Vikram Deshmukh, who is MBBS, MS, DNB urologist. He has a rich experience and hands-on expertise in stone management as well as in treating urological problems. He is currently practicing as he is the director, Sri Urology Hospital, Amravati. It's such a pleasure to have you with us, Dr. Vikram Deshmukh. A very warm welcome to you, sir.
Yeah, thank you very much. Thank you for having me on this show.
So, doctor, today we are going to talk about BPH, जिसे हम बहुत आम भाषा में कहते हैं नॉन कैंसरस एनलार्जमेंट ऑफ प्रोस्टेट. अब प्रोस्टेट एक ऐसा ग्लैंड है जो कि पुरुषों में होता है, which is a male, organ or gland. First of all, we would try to understand, or we would like you to tell us what is prostate, where it is, positioned in a male body, and what are its functions, etc. And then we'll move forward with BPH.
Right. So prostate is a male sexual accessory gland which stores some part of the semen, and it is located uh, underneath the bladder and through which the urinary passage, that is the urethra passes. And when you are passing urine, if there is prostatic enlargement, any prostatic disease, this may lead to urinary symptoms because the prostate can cause obstruction to the urinary passage.
Right. And now talking about BPH, doctor, what is BPH? Why it is caused?
So BPH is basically enlargement of the prostate. BPH is actually a misnomer because that uh, diagnosis will only get once we remove the prostate and send it for histopathological examination. So the uh, right term to describe this pathology is benign enlargement of prostate. So benign word itself says that this is a non-cancerous disease, and benign enlargement starts at the age of 40 because this is a slow progressing disease. The symptoms generally start after 55 or 60 years of age, and these symptoms can be a variety of obstructive and irritative lower urinary tract symptoms like decrease in the stream of urine, frequency of micturition, urgency. Sometimes you have obstructive symptoms like poor stream, hesitancy, or breakage in the stream, that is intermittency, or a sense of incomplete evacuation of urine.
Okay. So these are the symptoms that are associated with BPH. And as you said, doctor, can we also say that, benign enlargement of prostate is a sign of aging? ये उतना ही natural है जितना बालों का, a certain point of time के बाद सफेद होना, graying of hair है, या चेहरे पे wrinkles आना है. So is it a sign of aging?
Right.
Okay. Now, because we are talking about BPH, doctor, you also told us about these symptoms. लेकिन एक बार फिर हम चाहेंगे थोड़ा डिटेल में अगर आप लक्षण बताएं, क्योंकि एक सर्टेन एज के बाद जो आपने सिम्टम्स बताए हैं, चाहे वो फ्रीक्वेंसी, अर्जेंसी से रिलेटेड हो, ये बहुत कॉमन होता है. Many times we have seen people saying that, when we ask them that why are you going so frequently to the washroom, or is there an issue? Let's go and talk to a doctor. Then probably they'll say that, I'm aging. So it's
Right.
bound to happen, or I'm a diabetic, or I have thyroid issues, etc., etc. So I'm bound to have these symptoms and I'll have to live with it. So this is a very normal notion people normally have. So if you
Right.
can just first of all elaborate the symptoms so that people can connect कि अच्छा ये भी BPH में होता है, benign enlargement of prostate में होता है.
Right. As I've already mentioned, this is a slow progressing disease. So though the enlargement starts at the age of 40, because there is a very slow progression, people think that this is a part of aging. They don't have majority of them. They don't have a sudden development of the symptoms. So they will feel that this is a part of aging, and many of them delay getting medical treatment. But basically, can you just repeat your question?
The various symptoms, doctor, if you can elaborate the
Yes,
symptoms.
yes. So symptoms may be of two types, that is irritative lower urinary tract symptoms and obstructive lower urinary tract symptoms. So basically, as I've told, prostate is the gland beneath the bladder, and urinary tract is passing through the prostate. So if there is enlargement of, if there is increase in the muscle tone, that will cause obstruction to the urine flow. Now, obstruction can lead to decrease in the stream of the urine, that is poor flow. It may lead to retaining the urine in the urinary bladder, so the patient will have a sense of incomplete evacuation of the bladder. It may cause hesitancy, that is, patient goes to the urine, but he is not able to start the stream immediately, or it takes a lot of time. And sometimes he has a stream which is intermittent, that is, it starts and stops. So these are obstructive symptoms which is caused by the mechanical obstruction caused by the prostate to the urinary passage. Now, this obstruction can also cause a storage dysfunction, that is, the bladder, which is a storage area where the urine is stored. It can cause dysfunction in the storage function of the bladder. Now, this can lead to increased frequency, especially in the night, that is called nocturia. This patient has to get up multiple times in the night. Uh, he may also land up with daytime increased frequency, and sometimes this may even progress to urgency. That is, he is not able to hold urine and he has to immediately go to the toilet or rush to the toilet. Sometimes, if this progresses, he may also wet his clothes while he is able to reach the bathroom. So these are the irritatives, that is storage dysfunction of the bladder, which is leading to irritative lower urinary tract symptoms.
Right.
It may sometimes also lead to painful micturition, that is dysuria.
Okay. So these are the symptoms, and the bottom line is that in case you have these symptoms, please do not hesitate to go and consult a doctor. Go
Right.
to a specialist, which is a qualified urologist. So,
I
कई
will
बार
I
होता
will
है
like
डॉक्टर.
to add
Yes.
add something here. These are what we called irritative and low urinary tract symptoms. If the patient doesn't take treatment, then this may even progress to complications, like patient may have a sudden stoppage in the urine, which is called as retention of the urine. He may not be able to pass urine, and sometimes it may lead also have other complications, like he may land up with urinary tract infection, which may cause painful micturition, that is dysuria. He may all that if the infection spreads to the body, he may start having fever, that is because of urinary tract infection. And sometimes the bladder may completely lose its elasticity, so that pressure in the bladder can go to the kidneys, and he may also land up with renal dysfunction or renal failure. So if timely management is not done of the symptoms, then the patient will land with complications which I've just narrated.
I think this is a very important part. If left untreated, the complications can be really grave. You can, I mean, even kidney dysfunction or kidney failure could be, one of the complications. So please don't stretch it to that. अगर ये symptoms है, the simplest thing you need to do is to go and consult a doctor, go and consult a qualified urologist. क्योंकि कई बार होता है डॉक्टर, जब इस तरह की चीजें होती है, जैसा कि पहले भी मैंने कहा कि लोग कहते हैं कि अब तो एज हो रही है, या मुझे डायबिटीज है, दूसरी प्रॉब्लम्स है, तो ये तो होना ही है, तो मुझे इनके साथ ही रहना है. तो क्या रहना ही है इन सिम्टम्स के साथ, या प्रॉपर ट्रीटमेंट अवेलेबल है, रिलीफ मिल सकता है?
देखिए, मैंने जैसा आपको बोला कि if you don't take treatment, this is a progressing disease. So initially, patient will have nocturia. If he doesn't consult the doctor or doesn't take treatment, it will progress to the other symptoms. If still he doesn't take treatment, it will lead to bladder and renal dysfunction also. So you may have, or you may land up with complications. So basically, if you take early treatment, uh, the nature of the treatment may be non-invasive, that is, medical treatment may be enough. If the patient comes very late, then he may land up with surgery, or sometimes uh, even the surgery may not help him. So timely intervention is very important, and we have very good treatments, medical treatments, which are now available. In the last 2 decades, the surgical multiple options of surgeries have also come up. So timely intervention is very, very important.
Right. So timely intervention is very, very important. And if you have these symptoms, please go and consult a qualified urologist. We'll talk about the treatment options in detail. But before that, doctor, एक तो आपने कहा कि symptoms है, जो आपने symptoms बताए, तो आपको डॉक्टर के पास जाना है. कई बार ऐसा होता है कि सिम्टम्स नहीं है, लेकिन मान लीजिए एक मेडिकल चेकअप करवा रहे हैं रूटीन या कुछ और करा रहे हैं, अल्ट्रासाउंड करवाया और पता चला कि प्रोस्टेट का साइज बहुत बड़ा हुआ है, लेकिन सिम्टम्स नहीं है. तो इस तरह के
Right.
पेशेंट्स जब आपके पास आते हैं, क्या ये एसिम्प्टोमेटिक भी हो सकता है, और अगर होता है तो तब क्या करना चाहिए?
Right. This is a very important question. As I've told, this is a natural part of aging. So prostate enlargement can happen without symptoms. We will divide these patients into 2 categories. One patient who is not having symptoms and also not having any complications related to the disease, which can be identified on the test that he has performed, that is like ultrasound, urinary examination, and other patient who doesn't have symptoms, but the investigations are showing bladder or renal dysfunction, or complications related to the prostate. Like the first patient, he just has an enlarged prostate, but he's not retaining any urine, he's not having any symptoms, his flow is good. So we have checked his flow, we have done ultrasound, we have checked his urine, we have checked his renal parameters, renal blood tests we have done. So everything, if it is normal and he's asymptomatic, you may continue to put him on watchful waiting. That is, he may come up for annual checkup just to be sure that he is not developing any complication related to the enlargement of the prostate. The other patient, though he is not symptomatic, but if his flow is poor, if he's retaining urine in the bladder, or he is having sometimes renal dysfunction can also happen, though the patient may not feel any symptoms. So in that case, we have to intervene, because if we don't, then sometimes he may land up with serious, even life-threatening complications. And
Right.
then even the surgery may not help this patient, and he may land up with urinary catheter for the rest of his life. Because
So,
eventually this will progress. Eventually, he will land up with serious and life-threatening complications can also happen.
right. So bottom line is that in case you have symptoms, please go and check with a qualified urologist. In case you are asymptomatic, still you came to know that the prostate is,
Yeah,
enlarged.
I will again like to add here that even if patients are not having symptom, as we
Mhm.
know, every male will have a prostate, and majority of the males will have some or the other prostatic disease in the later part of life. So, generally speaking, after the age of 55, prostatic health screening is advised. So all males should undergo estimation of the serum PSA, and they should contact a urologist and see that his ultrasound parameters and uroflowmetric parameters are in the normal range, so that they don't land up with a situation which just the previous question I told you about, the second group of patients who are asymptomatic but they have uh, problems because of the prostate, and which later on may create problems. He may land up with a surgery. If he treats them early, he may avoid a surgery by taking early medical treatment. So, routine prostatic evaluation and checkup annually after 55 age is very important.
बिल्कुल, तो 55 साल की उम्र के बाद पुरुषों को एक रूटीन स्क्रीनिंग जरूर करवानी चाहिए, बिकॉज जैसा कि डॉक्टर ने कहा है, ये एक साइन ऑफ एजिंग है, ये सूनर और लेटर होगा ही, ये एसिम्प्टोमेटिक हो, सिम्टम्स हो, लेकिन इसका ट्रीटमेंट जरूरी है, तो ये जरूर ध्यान में रखें। अगर आप पुरुष हैं, 55 ईयर्स से ऊपर आपकी एज है, और भले ही सिम्टम्स ना हो, लेकिन एक एनुअल मेडिकल चेकअप आजकल बहुत से लोग करवाते हैं और करवाते रहना चाहिए। उससे आपको एटलीस्ट पता रहता है। तो एक प्रोस्टेट स्क्रीनिंग भी होनी चाहिए। डॉक्टर, बेनाइन प्रोस्टेटिक हाइपरप्लेसिया की हम बात कर रहे हैं, यानी वो एनलार्जमेंट ऑफ प्रोस्टेट जो कि बेनाइन है, जैसा कि आपने कहा नॉन कैंसरस है। तो अगर एक नॉन
Right.
कैंसरस है, तो कैंसरस प्रोस्टेट एनलार्जमेंट भी होता होगा, एक प्रोस्टेट कैंसर भी होता होगा। उसके बारे में भी
Right.
हम थोड़ा आपसे जानना चाहेंगे, खास तौर पे सिम्टम्स को लेकर। क्या सिम्टम्स अलग अलग होते हैं अगर बीपीएच है या प्रोस्टेट कैंसर है, या सिम्टम्स मोर और लेस सेम है?
देखिए, सिम्टम्स जो बिनाइन एनलार्जमेंट में आते हैं वो तो रह ही सकते हैं, लेकिन प्रोस्टेट कैंसर जो है ये शरीर में फैल सकता है या फैलता ही है, अगर उसको सही में ट्रीटमेंट ना मिले तो अगर ये शरीर में फैल जाता है तो पहले तो ये जनरली बोन्स में फैलता है। अगर ये बोन्स में फैल रहा है तो कभी कभी पेशेंट को रीढ़ की हड्डी में पेन होना, या कभी कभी उसके और भी कॉम्प्लिकेशन, जैसे फ्रैक्चर अगर हड्डी हो गई तो उसके कभी कभी नर्व कंप्रेशन होता है, पेशेंट का जो पैर का जो पावर है वो पूरा चले जा सकता है। तो इस टाइप के मल्टीपल कॉम्प्लिकेशंस बिकॉज ऑफ द स्प्रेड ऑफ द डिसीज दे कैन हैपन। So benign enlargement will generally cause symptoms because of the local obstruction. Prostatic cancer can cause local obstruction plus symptoms because of the spread of the disease in the body. So that is a more serious problem, and it is generally a uh, life-threatening problem also if not treated early.
प्रोस्टेट कैंसर को लेकर कहा जाता है डॉक्टर, देयर इज अ सिल्वर लाइनिंग दैट इट स्प्रेड्स comparatively slower than other form of cancers.
Right,
So,
right.
is it even more important because अगर आप early detection हो जाता है, early diagnose हो जाता है कि prostate cancer है, तो are there chances of better survival, better treatments, etc.?
Yes, compared to the other cancers, prostate cancer is a slow-growing cancer, but this is true only for majority of the patients. A subset of the patient, that is almost a third, one third of the patients may have aggressive disease. So unless you have graded the cancer by doing a biopsy, and once you have the histopathological grading, that will tell you what is aggressiveness of the cancer. If it is a slow growing cancer in some patients, we may also keep them on watchful waiting. Okay. But if it is an aggressive cancer, there are multiple parameters to assess that. Then these patients, if they are in below 75, they should undergo surgery to remove the prostate completely, which can also give them curative treatment. Other people in which the prostate has spread to the disease, still there are multiple treatments available, and they can have a 2 to 5 year survival even if it is a stage 4 disease.
Okay. Now, talking about again benign enlargement of prostate, doctor, when a patient comes to you with the symptoms or no symptoms, what are the tests that you normally recommend for proper diagnosis?
Right. So once the patient comes with any symptoms, or even if there are no symptoms, generally first thing that we'll do is to do an ultrasound of the kidney, ureter, and bladder region. And this will generally tell us the prostate size, what is the configuration of the prostate, whether there is an enlargement of the median lobe. It will give us the assessment of the bladder, whether the bladder is having any complications related to the obstruction, like thickening in the wall of the bladder. If he's retaining urine, that the amount of urine which is being retained will be shown. Uh, this will also give us the imaging of the kidney. So if some patients may have obstruction of the bladder, which is leading to the kidneys getting damaged, that will also be shown. After this, we may do a uroflowmetry, which is a test in which the patient voids in a machine, which is a uroflowmetry machine, and this will give us the flow rate. So, flow rate, if it is very low, then this suggests significant bladder outlet obstruction, and this will mandate that the patient will require medical treatment or sometimes even surgery, depending on the flow of the patient. We will also do a serum PSA, which is a blood investigation to screen the patient if he has malignancy, that is cancer. And before this, we'll definitely do an examination, which will also give us an idea whether the bladder is palpable. Uh, we will also do a digital rectal examination to feel the prostate through the rectum, which will also give us an idea if there is any chance of cancer in the prostate. So once we have this basic evaluation, if we think that patient requires any surgical intervention, then we will also do a preoperative checkup. And then based on these basic investigations, we will then decide whether to choose medical treatment or to choose surgical treatment.
So these are the tests that are normally recommended by a doctor so that they can, easily diagnose what is the problem, what is the status, etc., and decide the line of treatment accordingly. ना डॉक्टर पहले भी हमने बात की थी लाइन ऑफ ट्रीटमेंट पे, ट्रीटमेंट ऑप्शंस पे, और हमने कहा था इसको डिटेल से हम समझने की कोशिश करेंगे। तो मेडिकल इंटरवेंशन और लाइफस्टाइल मॉडिफिकेशन और सर्जरीज, बेनाइन एनलार्जमेंट ऑफ प्रोस्टेट, इसके बारे में प्लीज डिटेल में बताइए।
Right. So whenever we have a patient with these symptoms, first and foremost, we should check whether he's drinking too much of fluids. A lot of patients think that drinking a lot of fluid will be beneficial to their health, and they end up drinking much more than what they should. So this will lead to increase in the frequency just because of increased fluid intake. So we need to tell the patient that they should restrict their fluid intake to 1.5 to 2 liters, especially if they are in the elderly category, that is more than 60. And they should avoid ingestion of excessive fluids 3 hours before bedtime. Many people are also in the habit of having a lot of tea and caffeine. So these can have a diuretic effect. And if they reduce the consumption of these products, then automatically they will have a decrease in the frequency. Majority of these patients will require medical treatment. So we have a group of medicines which are called alpha blockers, like tamsulosin, alfuzosin, silodosin. This can help to reduce the tension in the prostate. And the other group of treatment is finasteride and dutasteride, that is 5-alpha reductase inhibitors, which can help in the decrease in the size of prostate over few months. This is medical treatment. If we think that the patient requires surgical treatment, then the commonest or the gold standard surgery that is offered is TURP, that is transurethral resection of prostate. There are multiple other options also, like holmium enucleation of prostate. You have other non-invasive methods of resection. Sometimes the patient may also be advised open surgery if he's in a remote place and where uh, uh, these non-invasive or the minimally invasive treatment modalities are not available.
Fair enough. So there are lifestyle modifications, there are medical treatment, medical management, and surgeries. And the best part about surgeries these days, as we all know, and doctor have also mentioned that, earlier surgeries से हम लोग को इतना surgery word से ही इतना डर लगता था, हमें लगता था surgery यानी open surgery है, बहुत लंबी चीरफाड़ होनी है। लेकिन अब बहुत सारे टेक्निकल एडवांसमेंट्स हो गए हैं, मेडिकल साइंस में बहुत एडवांसमेंट्स हुए हैं, तो काफी मिनिमल इन्वेजिव टेक्निक्स आर देयर। लेकिन जरूरत ये है कि चाहे सिम्टम्स हो या ना हो, अगर नहीं है तो आप नॉर्मल एक स्क्रीनिंग जो है एनुअल करवाते रहिए प्रोस्टेट की, और डॉक्टर के संपर्क में जरूर रहिए। एक यूरोलॉजिस्ट इसमें आपकी मदद कर सकते हैं। एंड प्लीज ट्रस्ट योर डॉक्टर, इट्स इक्वली इंपॉर्टेंट। कई बार होता है डॉक्टर, स्पेशली मेडिकल मैनेजमेंट में, कि आपने दवाई बताई, मान लीजिए 2 महीने की, 3 महीने की, हमने 1 महीने लिया, लग रहा है कि अच्छा अब तो आराम हो गया, देन वी स्टॉप following the prescription. Again, when we
Right.
get the symptoms, because now we have the prescription with us, we'll go and get the medicines and start it all by ourselves without keeping the doctor in loop. I'm sure you also get patients like that, right? So
Right.
what's your
Right.
advice to them?
See, as I've told that this is a slowly progressing disease, and eventually the patient will develop symptoms after a lot of uh, years. So the treatment will also have a slow effect, and if he stops the treatment because he feels that uh, he is feeling fine, he should know that the treatment will take months to alter the progress of the disease. So he will feel better for few days or few months, but eventually the disease will again progress and he will again land up with, sometimes he may even not know that he's landing up with complications. So it is better to keep regular follow-up with the doctor. At least 3 monthly follow-up is recommended. And if the disease is very stable, the doctor may increase the length of follow-up. But keeping the doctor in loop and keeping regular follow-up is very, very important. Sometimes the patients may also have side effects because of the medicines. In the initial few months, if the patient develops some side effect, the doctor may require to change the medicines. Sometimes the prostate may decrease in size over few months, and the doctor may even stop one of the medicines. Sometimes patients are prescribed a combination of alpha blockers and 5-alpha reductase inhibitors. So sometimes if the prostate is reduced in size, he may even need to stop the medicines, which will also decrease the cost of the treatment. So keeping regular follow-up is important because even though you are taking the treatment, still in some patients the disease may also progress. So whether the disease is progressing or not, you may also require to do an annual ultrasound examination, sometimes a uroflowmetry examination. Some patients are borderline patients, that means the doctor has given them a chance that we'll see how the medicine will, how the patient will respond to it for surgery. But eventually, these patients may land up with increase in the or sometimes progression of the disease, and they may be advised a surgery eventually. So unless you do a regular follow-up, it is very difficult to for the patient to assess whether he is on the right path or not, or whether there is requirement in the change of the treatment, or whether a change in the medications is needed.
So proper follow-ups are also important. I mean, you are taking treatment, that is okay, but then you also need proper follow-ups, and keep, keeping in touch with your doctor is really what you need. Now, doctor,
Right.
we have just spoke about कि benign enlargement of prostate के क्या टेस्ट होते हैं और किस तरह से उसे diagnose किया जाता है, then क्या treatment options है. If you can shed some more light over prostate cancer, the test
Right.
you have already mentioned about PSA कि वो तो होता ही है, उसके अलावा भी कोई टेस्ट है, and of course the treatment options available for prostate cancer.
Right. So basically, whenever we have a suspicion of prostate cancer, we will do two tests. That is, one is digital rectal examination. That is, we put a finger through the anus into the rectum, and we feel the posterior part of the prostate through the rectum. In a prostatic cancer, the prostate will not be firm as in benign enlargement. It will be hard in consistency, which will raise a suspicion of prostate cancer. Then we will also check his serum PSA, which is a blood test, and if it is in the higher range than normal, then this again reinforces our suspicion. If any of these tests uh, give us a suspicion of prostate cancer, this patient is subjected to a prostate biopsy. That is, we have a ultrasound probe which is inserted through the rectum, and we get a ultrasound guided transrectal biopsy. That is a truss guided biopsy. Truss is basically transrectal ultrasound. So under transrectal ultrasound guidance, we'll take 10 to 12 core biopsy. That is, a needle is passed through the rectum, and about 10 to 12 cores are taken out and sent for histopathological examination. This biopsy report will confirm or refute the diagnosis of cancer of the prostate. It will also give us the type of the cancer and the aggressiveness, that is the grading of the cancer. Aggressiveness or grading basically means the ability of the cancer to spread in the rest of the body. So if it is a low grade cancer, it means that the patient has a cancer which has less potential to spread to the other part of the bodies. If it is a highly aggressive cancer, this patient will require aggressive management depending on the staging. Staging means once the patient has a confirmation of the diagnosis, we will do other tests to check uh, where the prostate has spread in the body. So first, generally we'll do a bone scan, or sometimes we also now have a PSMA PET scan, which will give us an idea whether the prostate has spread to the bones or to the other organs like lungs, liver. And then once we have the staging, that is, we have knowledge about the spread of the disease, we will grade the patient into stage 1, 2, 3, 4. 4 is basically the disease has spread to the whole of the body in the multiple sites in the body. And stage 1 is where the prostate disease is localized. So stage 1 is basically where the patient can have curative treatment if we remove the prostate. Stage 4 is basically a stage where we cannot offer a curative treatment. We have to offer him palliative treatment. Palliative basically means that the treatment which will only aim to keep the cancer or their symptoms under control. We cannot cure the patient in stage 4. We can only control the disease for few months or few years and keep the patient's quality of life slightly better than without treatment.
Right. And Doctor, we are getting so many questions by our viewers. A very common question people often ask is, in case of both, benign enlargement of prostate or prostate cancer, after the treatment, etc., can they lead a normal sexual life?
Yeah, so basically we will divide these patients into either benign enlargement of prostate cancer. So benign enlargement, if the patient is on medical treatment, generally sexual life will be improved because of the treatments, because these patients, once they start treatment, they have urinary symptoms, and this reproductive system and urinary system are combined. So once we treat the disease of the prostate, it will improve their urinary parameters, but at the same time, the sexual performance will also improve. One thing I would like to add is many of these patients in the elderly age, because of the decrease in the sexual frequency, many of these patients will also develop prostatitis. Prostatitis is basically there is inflammation or infection in the prostate, which aggravates the symptoms of the benign enlargement. So, if they are sexually active, their performance will improve with treatment. Surgical treatment like TURP or holmium enucleation sometimes may lead to ejaculatory dysfunctions, like the patient may have a retrograde ejaculation. Medical treatment like psilocybin drug may also lead to ejaculatory dysfunction in some patients. So if the patient is having ejaculatory dysfunction and he is sexually active and he doesn't want this side effect, then we may have to change the medication. In TURP, we have now we have techniques of TURP which can even preserve the ejaculation. So depending on the patient, whether he is sexually active or not, we may alter the nature of the treatment. In prostate cancer, depending on the treatment that we are offering, his sexual life may or may not be impaired. So I think that is basically a topic that will require some more time. I think we don't have that much time to describe in detail how it will affect. But generally speaking, if the patient is having stage 4 disease, uh, he may not be sexually that sexually active, and saving his life takes more priority than the sexual performance in this category.
Absolutely, absolutely.
Generally speaking, sexual well-being should not be much of a cause. Uh, you must understand that whenever we are talking about treating the patient, the improvement of the urinary parameters takes a precedence over his sexual well-being. Because if he is not able to pass urine in a proper way, his sexual well-being will not be achieved. Once he is able to pass urine and he is not having any urinary problems, then only he will be able to perform better in his sex life. So
Right.
generally speaking, once his urinary parameters improve, his sexual parameters will generally improve on their own.
Absolutely. There are many other questions, but we have already discussed them in our conversation. One question by Yash Namdev. Can BPH cause bladder stone?
Yes. As I've told, the prostatic enlargement, it causes obstruction in the prostate, and this leads to stagnation of the urine in the bladder. This stagnant urine can lead to multiple problems, like it can lead to recurrent urinary tract infections, and bladder stones can also happen because there is residual urine in the bladder after you pass urine. So if there is a if there is a stone in the bladder, um, this is an absolute indication to operate the patient. These patients cannot be treated by medical treatment.
Right. And doctor, before we sum up the whole session, any take-home message for our viewers?
Yes, I would basically advise all men to take the prostatic health seriously, because, as we have discussed, prostatic cancer is the commonest cancer in males, and regular screening for prostate cancer after age of 55 is recommended. At the same time, I will also recommend all men to undergo regular health screening by visiting the urologist on an annual basis. Those who are taking the treatment for prostate, even if they have got operated, they should take regular follow-up with their urologist. At least annual follow-up is recommended. Those who are on medical treatment should do a follow-up at least 3 monthly, or as per the advice of the urologist. So this is very important, and you should always keep the urologist in your loop whenever you have urinary symptoms, so that you have a healthy life, and you don't land up with complications related to a prostate. And we have multiple excellent treatments, non-invasive treatments, which can offer excellent quality of life. And I wish all the men they will uh, take this advice and keep themselves and their family members healthy.
Absolutely. Thank you so very much, Dr. Vikram Deshmukh. It was wonderful talking to you. Thank you for your valuable time, sir, and also this very informative session for our viewers. Thank you so very much.
Thank you. Thank you very much.
And viewers, thank you for your excellent participation. For more information and updates, stay connected on our FB page, Prostate Wellbeing. We are also available on YouTube, Twitter, Instagram. Thank you and have a great day ahead. Goodbye.
Yeah, thank you.